As you heard in that report, the relationship between Arizona and Mexico is critical. KJZZ, our sister station in Phoenix, has a special team dedicated to covering issues between the two nations. I'm joined now by Kendall Blust and Murphy Woodhouse, Fronteras Desk correspondents with KJZZ. My thanks to both of you. Murphy, I want to begin with what's happening on the ground in Mexico right now. Are there restrictions in place?
So in Mexico, it's very difficult to talk about a single thing happening uniformly. It's been a lot of different responses in different states, some acting more aggressively, some less so, and then the federal government, some say not acting as quickly as perhaps would be prudent.
Kendall, Mexico was criticized early on for not putting restrictions in place quickly enough. What are Mexican nationals saying about the government's response to all this?
No, you're absolutely right. The Mexican government's response was slow, and this week that's changed somewhat. They have announced that they're now in stage 2, which is local transmission of the disease. And because of that, they have started to put some of these measures in place to slow the disease, asking people to stay home, extending school holidays, and even the sort of on the interesting side, they have some social media videos and this cartoon character named Susana Distancia who shows people how to stay 6 feet apart. But yes, there's been a lot of backlash and a lot of criticism of how the president Andrés Manuel López Obrador has responded to this, the sort of slow response of the government, and then also his behavior on a personal level, holding rallies, attending events with hundreds of people where he's given hugs and handshakes and kissed babies. And so he's saying he's not going to be doing that anymore. And, but there's still a lot to see on how that's going to move forward during this crisis.
Murphy, how's the healthcare system in Sonora and beyond on the federal level equipped to handle this sort of pandemic?
There is a fair amount of anxiety about how prepared both the federal healthcare system is, as well as the healthcare systems in states around the country are for what is expected to be a great deal of demand from sick patients. So the outlet Animal Politico in Mexico has recently reported that there are a little more than 5,500 ventilators in the country, and those are, of course, used to treat very serious cases. And then there have been protests among healthcare providers, healthcare professionals, saying that they don't have access to critical equipment like gloves and masks. Even before all of this started, there were already protests being seen in Mexico about healthcare access and the quality of healthcare. And so this will likely only make a complicated situation even more challenging. But, with countries in Europe like Italy and Spain currently going through an extremely difficult time having their healthcare systems very much overwhelmed by COVID-19, there are a great number of people worried that something similar could be seen in Mexico.
All right, and Kendall, in the short time that we have, I know there are restrictions in place along the border, primarily for essential travel. What's been the relationship like between the two border states, especially here, Arizona and Sonora, with limited travel now?
Right, exactly. So non-essential travel has now been limited, at least for entry into the United States. So that's tourism and recreation, although the border is still open for essential things like getting medical care, going to school or to work. And the U.S. border for northbound crossers is open to U.S. citizens and residents. That has still had a lot of impact on both sides of the border. There are a lot of border cities in the north side of the border that really rely on Mexican shoppers, both for individual businesses who need to keep their doors open and for cities who rely on those sales taxes. And south of the border, a lot of it is tourism that we won't be seeing, and so that it is going to have a large economic impact and also social impact. People have family members on both sides, but there is some difference in how the U.S. and Mexico are responding to this. So the U.S. obviously at this point has many more cases than Mexico, at least confirmed cases, and there's plenty of argument about how accurate that is. But that being the case, the U.S. has stronger restrictions. Mexico does not seem to be enforcing a lot of the same restrictions. And just this week, we saw on Wednesday protesters in Nogales, Sonora, who closed down southbound lanes to demand that the government take stronger action to spread the flow of coronavirus and to prevent people crossing the border into Mexico who might have coronavirus. And so on Thursday, we did see that there were actions being taken, people's temperatures were being taken, and that is apparently a local response directly to those protests.
All right, certainly a new normal there along the U.S.-Mexico border. All right, my thanks to both of you for your insight.